So I'll just kind of frame where we are. So we're about 6 weeks out from starting the expansion. You just mentioned to me that you've started to notice something with your breathing. Can you tell me a little bit more about what you're noticing?
Yeah. So it's gradual. It's not a crazy difference, but I am noticing better breathing through my nose for sure.
Okay. What was the first moment where you were like, "Wow, I can feel a difference there"? Was it like the nighttime and while you're sleeping, or was it while you're doing some exercise? Kind of what did you notice?
I would say probably exercise or just like daily activities.
Okay.
There wasn't like a specific moment because I've always been trying to pay attention to what's going on because typically like my nose is congested during specific periods of the day.
Yeah.
Maybe it's like first thing when I wake up in the morning, or maybe after eating. Typically when a lot of the soft tissue is a little bit more expanded and everything's kind of but it's gradual. I mean, it's not a crazy difference just yet, but it's definitely noticeable.
Okay.
It's definitely noticeable.
Yeah, I'll have patients tell me like, and obviously it's more noticeable the more narrow and the more restricted you are, but for some that just they weren't ever able to like breathe fully through their nose, like on a long hike or walking up a hill or something like that. If you do something every day, you're like, and you're able to compare like, hey, I wasn't able to do this before expansion, and now it's like, hey, that makes that just makes it a lot easier, right? I think that's a really good comparison. And then we'll also cure patients who have like a history of chronic sinus infections, or I think we talked about this last time, but like when they have frequent colds, like they just get fully congested. And just having that little extra space to be able to breathe through the nose changes the level at which they're going to get a full blockage, right? They can still breathe through the nose even if they might have a little bit of a cold or something like that. So
absolutely.
Yeah, cool. Yeah, you guys are good. You can come in.
Oh, okay. I didn't know you were still.
Yeah.
It's okay.
Yeah, no, all good. Sweet. So you've been changing through your trays and doing the turns. What was like kind of the most surprising or unexpected thing that you've dealt with so far? Like what's been like, wow, I wish I knew that going into it, or I guess maybe some advice for people who are thinking about doing this, like something that you could have known about like before heading into this. Anything like that?
There's nothing too extreme. I mean, it's definitely an adjustment. Like having this thing, it takes up space in the mouth.
Yeah.
Eating, things get caught in there. Sometimes I have to like do like sucking stuff to pull the food out.
Yep.
Or either I go and I clean it out with the water floss. There's a lot of maintenance that needs to be done.
Right.
And I make sure, because the last thing I need right now is for any infection to happen.
Definitely.
So I'm very disciplined about cleaning everything.
Yeah.
And sometimes I might feel sensitivity around the screws or, the touch points where the palate expander is connected to the mouth.
Yeah.
And so sometimes if I feel a little bit of sensitivity, which might indicate the beginning of like, I don't know, maybe like some sort of minimal infection, I might gargle some salt water.
Okay.
And then I swish it just to make sure that kind of disinfects a little bit. But yeah, I mean, otherwise it's just. I
mean, look, you've had aligners before, so that part, you already knew going into it. But I think for a lot of people, after the initial kind of shock of having the expander in the mouth, it's like, hey, now I have to remember to take out the liner trays, put it back in after eating or whatnot, or after drinking a cup of coffee. So I think that is probably the hardest part for a lot of people, and just staying on top of that, because that part, you need to be diligent with for the whole time.
Yeah. And I would say when I had when I had Invisalign in the past, sometimes I would just get by with like one meal a day or something. I'll just intermittent fast,
Yeah. Yep.
But after speaking with Dr. Copleston, he said that actually should not be the situation, because I do have to consume calories. I do need to get protein in because it's critical for to provide like the building material to fill in all the gaps and for the.
Yeah.
So it's kind of like, okay, I have to take them out and I have to eat, and it's a lot.
Okay.
But it's it's worth it. Yeah.
Yep, absolutely. Like, how are you getting the protein now? Are you doing protein shakes, or are you primarily like, doing just whole foods? Like, how are you?
Whole foods, yeah.
Okay.
I mean, protein shakes, like it's okay, but there's, just consuming eggs and fish and beef and chicken. It just, I don't do, at the beginning when I did the surgery, and you're not allowed to eat hard stuff, I had to consume the protein shakes.
Shakes and stuff, yeah.
But now I don't want my jaw to be too weak. So
that's good. We have one patient who, went through this a few months ago, and he would tell me that he would grill chicken or boil it or whatever, and then he would put it in a blender and then take that to work every day and drink that for lunch. I'm like, man, that's a sacrifice. I don't know how you do that. That is nuts. But, to each their own. Like, some people are fine doing that. Others, want to have a little bit more variety. And so what that's going to mean is you just have to be more diligent with, like, keeping everything clean if you're going to be, getting some food stuck up in there. But
100%, yeah. Yeah, that's actually an interesting idea. I heard some people doing that, making like chicken, almost like chicken nuggets that way, and it's easier to like bite on.
Yeah, for sure.
So
awesome. Is there anything else we want to talk about, or should we just record the whole thing and we can do what we need to do today?
Yeah.
Okay.
We'll go straight in.
Perfect.
Definitely. I think the few things that I wanted to make sure we touch upon. Is so one, because I was trying to estimate the amount of time I'm going to be expanding. Because I know, like, right now I'm doing one turn. So I wear a tray for 5 days, and then I only turn on the second day and the fourth day.
Correct.
And we're only doing like, from solid to corner to solid. So the expansion is relatively slow, but I understand that's just part of the process.
Yeah.
I don't know how many millimeters, a fraction of a millimeter every turn results in, but I know that, at least based on the original analysis, based on the CBCT scan, I have roughly 9 millimeters of total expansion that was supposed to get.
We're aiming for 9,
So I was wondering, at least right now, where do I stand? Like, how much have I expanded so far? How much should I expect? And then another thing was also like that piece kind of broke off. I want to see if everything's okay.
Okay.
I do notice, I don't know if it has to do with that, but it's a little bit tender, but I don't know if it's just like biting in general, because, the jaw is broken after all. And the last thing was, so I had this one tooth over here, which was problematic from the previous treatment. I just want to get your feedback on if that's actually starting to turn around, because it's like twisted.
So to answer your first question about the expansion, so each of those swings that you go from the flat to the corner is a 1/12 of a millimeter. Okay, so you're doing 2 of those turns with every tray. So you're doing a 1/6 of a millimeter with every tray. Okay. So it's pretty much, if you multiply that out, you're doing a 1/6 of a millimeter every 5 days, right? So it works out to about a millimeter every 3 weeks, just about. We sometimes will speed it up. We'll add an extra turn for some people in the early stages, because we'll tend to track pretty well. But if you don't mind being in this process, everything fits better together if we kind of stay on a consistent schedule. And if we're going for 9 millimeters, right, that's essentially, if we get a millimeter every 3 weeks, it's like 27 weeks of turns.
Got it. Okay.
So you've been turning for about 6 weeks now, so roughly probably about 2 millimeters. So we're still like,
early in the process.
A quarter of the way there. Yeah, a little less than a quarter of the way there.
Yeah.
So it's good that you're feeling something now, but we're just kind of scratching the surface so far.
Got it.
I'd say most people will start to notice their airways open up, that breathing get a lot easier, right around like the 2 to 4 millimeter point in their expansion. So usually in the first month and a half to 2 months or so. So we're kind of right at that point where you're probably going to notice it. And when do you stop noticing it? Usually, by the time you're at like 4 to 5 millimeters, the nasal cavity that opens up pretty significantly, and if there's a blockage in a different part of the airway, then the airway is only going to be open as far as the smallest part of that airway. Right?
Yeah.
So if it's not an issue with your nose, Right, there might be another limiting factor that might be restricting that from, being able to fully breathe, right? So,
got it. Okay.
awesome. Let's take a look.
All right.
So it's going to be a lot more comfortable now that we're starting with the rubber bands. Usually people say that the rubber bands really helps to cushion the prongs coming out of the lower back teeth.
Oh, really? Okay.
Excuse me, yeah. So
it's really like, I guess it's like really like pulling it out. So all these teeth are just going to be like that.
exactly.
Right?
So we're going to be attaching the rubber bands from inside the lower aligners, right? And then we're going to be working their way outward by hooking up to the top. Exactly.
How many trays, by the way, of the trays that I'm having right now, how many of them are going to have these rubber bands?
Until the end of the expansion set.
Oh, really?
Yeah. So all of the ones that you have in the box are going to have these.
So all of them, essentially.
Yeah.
Wow. Okay.
But only up until the time we're done with the expansion. So our goal is to get you so you don't have to wear rubber bands once you're done with the expansion. Okay. So the way that you're going to use these is you're going to put the rubber band over the hook. So just take 2 fingers, make sure you wash your hands before. And what I do is I just leave the rubber bands on there, right?
All the time.
All the time. Yeah, even if you're not using it, even if it's not engaged to that hook, just leave it on there. I'd recommend changing it out once, maybe twice a day, right? Right before you go to bed is a good time to change to a new one.
To a new rubber band?
To a brand new rubber band.
Okay.
Yeah.
So I'm changing them how many times a day?
Once or twice.
Once or twice? Okay.
Yeah, once or twice a day.
So I'm going through a lot of, all right.
Yeah. So I'll have a couple extra bags for you. Now, what you're going to do is you're going to use this hook. So after they're in, right? See it in your mouth, right? You see it in your mouth. And then you're going to use this hook to grab just the top one, right? Grab the top one, and then you're going to hook it over that hook that faces backwards.
Got it.
Okay. The reason why we had to add that attachment that you probably feel on the inside of that lower tooth is because if you try to lift that, then the whole tray might lift in the back.
Got it.
So it's going to keep it in there. Yeah.
Okay.
So go ahead and put this top one in.
Okay.
Perfect. Let's put the bottom one in. Okay. And then for the first one, you're right-handed, right?
Yes.
So I'm going to do the left one for you.
Okay.
So you can see what it feels like. So go ahead and open for me. Good. So I grab the top one and then go ahead and slowly close down. Close down. Yep, perfect. And so what I'm going to do is I'm going to find the backwards facing hook and hook it over that. Just take it right out.
Oh, wow.
Feel that?
Yeah.
Yeah, you feel that force? Yeah, that's going outward. So do that same thing with the right one. So hook it over the top one and then hook it to that backwards facing hook. Let me give you a mirror so you can see. Okay. And it's always easier to hook it on to that hook when your mouth is more closed, right? If your mouth is, you did it? Oh, dude, you're natural. That was awesome. So when you're like talking a lot, right? It's probably going to be a little bit challenging to do it, to have it in. So what you're going to do is you're going to unhook it and just leave it sitting on the bottom, right?
Oh, okay.
Leave it just sitting on the bottom prongs, so that when you're ready, you can just hook it up to the top.
If I'm okay.
Right. So if you're talking a lot, if you're like in the middle of a meeting, or if you're on the phone or whatever it is, it's just getting a little uncomfortable. Just unhook it before, and as soon as you're done and you have some time to yourself, right? You're not talking whatever, like in front of a computer, watching TV. Just hook it back up. Most important time to have it on is when you're sleeping, right? So you definitely want to have it in when you're sleeping, and then at least 6 to 8 hours during the day as well, if you can.
Okay.
So to take it out, take a look in the mirror, see what I do. So you're going to open just a little bit. So I'm going to grab it here and then just pull it out and then just leave it like that.
Got it.
Okay?
Got it. Okay.
Make sense?
Makes sense.
Cool. And the trays are staying nice and stable, right? They're not lifting at all because I had that attachment there.
Oh, yeah.
Feels good?
Rock solid.
Yeah.
It's going to be hard to take off, probably.
It is. You were using your fingers to take it out before?
No, I always had to use that, like
the tool.
Yeah.
Okay.
It was always pretty hard.
Perfect. Yeah. So what I'm going to recommend now is that you probably want to, when you use that tool, so take a look. Let me get this bottom one out for the rubber. So when you use that tool, you have to get like really in the back, and really get like pull it like away from that tooth, right? Because it's gonna want to stop right there, right? And you'll figure it out, like how eventually to take it out. It might be a little tough in the beginning.
Yeah.
But just play with like where, if I grab it like more backwards or a little bit more, you know, closer to that tooth, whatever, you might find it's easier. So. Yeah,
that's what I did. I think the top one, the reason why because the top one was also holding really hard. I think that maybe I did it like incorrectly, and that's when it kind of like tore off the.
Yeah, if you torque it against the attachment, it's going to fall off. The best way to take it out is if you unhook it on both sides and then wiggle it forward away from the attachments. So you want to grab it from the inside, on one side, grab it from the other side, and then just pull it out and forward away from both the attachments.
Got it.
In the front.
Got it.
Cool?
Cool.
Sweet.
So are these rubber bands going to last me? These are supposed to last me until our next meeting.
I'm going to see you 6 weeks. Let me get you another bag just so you can have a spare.
Okay.
But I'll check in with you in 6 weeks. Keep going at the pace that you're going.
Same thing in terms of cranking.
Yeah. You're on tray number 10 right now, right? So you'll still go with the 2 turns. That's totally fine with the 5-day changes.
Okay.
Okay. Sweet. All right. I'll see you back in 6 weeks, and we'll check back in with you then.
Okay. Overall, everything's looking good, and
everything looks fantastic. Yeah. Everything's fitting really well. The space is maintaining to the level that we want it to. Yeah. Everything's going great.
Okay. Awesome.
Good stuff. All right.
All right. Thank you so much, doctor.
You're welcome.
I really appreciate it.